And I am officially live. It has been way too long. Let me just quickly check this, make sure you guys can hear me. Because apparently I've been having issues with my sound. Hold on. Apparently I've been having issues with my sound. Okay. It seems to be okay. And alrighty, so here we go. Let me get this up and running. So first of all, it has been quite a while. I've been so crazy busy, like I can't even tell you. But always, of course, thinking and brainstorming and trying to consider what I should talk about. And this kind of came to me randomly today, actually, because I've been playing with a few different ideas of what I wanted to talk about in my head. And I realized that genital mutilation is something that I learned about back when I was studying in undergrad. And it obviously it isn't something that's very prevalent here for us, but in other countries it's used to be a very common practice, and still, under the wire in some areas it is. But it's very interesting to me that this is something that we can recognize as wrong and shouldn't be happening to our young. It mostly happens, this is genital mutilation. When we talk about that topic, it's mostly female, because obviously the male equivalent is pretty much what we know as circumcision. So it's still not, I don't believe it's something that should be practiced, but it doesn't affect a male. So anyway, I said all that to say that if we can recognize that the genital mutilation on females is wrong, then how is it that we can't recognize that? Hey, citizen man, how you doing out there? How is it that we can't recognize that, altering a child's genitals in any way is wrong? So let me just, take it back a little. If you didn't know, which you obviously have to know if you're here, I did not mean to do that. Just moving too fast for myself. So our title tonight is Genital Mutilation versus Gender Reassignment Surgery. What's the difference? Right? And that really is the question that I want us all to keep on the forefront of our mind as I go through this information. So I'm going to start by giving you a little background of what is genital mutilation, what is gender reassignment surgery, which, again, if you're here, you should probably know that. But in case you don't, we're going to start there. And then we can kind of discuss, if there are any real differences in our opinion. And I always forget to say, if you're here, don't forget to like, subscribe. Because, going forward, I plan to have my lives a little bit more evenly spaced. However, if I do have a gap like I did just now, you'll get that bell and you'll know what's going on. Okay, so to start, this is what the U.S. government says female genital mutilation is, right? So they refer to it as FGM/C, because it's female genital mutilation / cutting, right? And in the United, just make sure you guys can see that. Because again, okay, good, perfect. So they start out by saying that the United States is committed to ending female genital mutilation or cutting. If you believe you are at risk, know someone at risk, or have questions, or have undergone female genital mutilation or cutting, and need help or further information, contact the number below. Now, what is it? It refers to cutting and other procedures that injure the female genital organs for non-medical reasons. Is it bad? Can you not hear me? Because I did change my mic settings, but I thought it would help. I'm also going live from my bathroom because I have access to nothing else in the house. Can you not hear me? Because I did. Citizen man, sorry, I just started talking to you. Are my mic settings bad? Is it hard to hear me? Okay, because when I play it back, I feel like I'm muffled. Um, dang, I need a real mic, man. This ain't working for my life. You know what? Let me try something. Just hold for me really quick. I will be like you're on the camera mic. Okay. Um, just give me 1 second.
Oh, forgot to put my headphones back in. Hold the phone. Okay. So is that any better? Mic check, mic check. Hold the phone. Okay. So is that any better? Okay. Mic check, mic check. Perfect. Thank you, sir. Appreciate you. Okay, so I'll start over. What is female? Perfect. Thank you, sir. Appreciate you. Okay, turn that down. What is female genital mutilation / cutting? It refers to cutting and other procedures that injure the female genitalia organs or for non-medical reasons. It may be called female circumcision in certain parts of the world. The practice has no medical benefits and can lead to a range of physical and mental health problems. So just that already kind of got my wheels turning because it clearly states that it is it refers to cutting and procedures that injure the female genitalia for non-medical reasons, right? So basically you're cutting and it's not like she's being harmed by something that you're cutting off of her, right? Which obviously in a gender reassignment surgery, that's exactly what they have to do. They have to cut out healthy organs, right? Now, what are the health effects? Immediate effects can include blood loss, severe pain, and sometimes death. Long-term health problems can include urinary infection, fistula, infertility, painful menstruation or sexual intercourse, and a potential increase in the risk of HIV/AIDS infection. In addition, women who have had female genital mutilation or cutting are significantly more likely to experience difficulties during childbirth, and their babies are more likely to die. What are the health effects? I just read that, right? And their babies are more likely to die as a result of the practice. Finally, the practice often leaves girls and women feeling scared, psychologically scarred, embarrassed, and distressed. What is the US government's view? The US government opposes female genital mutilation and cutting no matter the type, degree, or severity, and no matter what the motivation for performing it. The US government understands that female genital mutilation and cutting may be carried out in accordance with traditional beliefs and as part of adulthood initiation rites. Nonetheless, the US government considers it to be a serious human rights abuse and a form of gender-based violence and child abuse. Which again is very interesting to me because is that not what gender reassignment surgery is when we perform it on children? Child abuse. And when it comes to this genital mutilation, they oppose it no matter the type, degree, or severity, or the motivation. So why is that not the case when it comes to cutting? Providing this, yeah. The United States is committed to ending female genital mutilation to protect the health and well-being of and the advance of the rights of women and girls globally. The United States is working at home and other countries to help educate people about the serious damaging effects of genital mutilation on women and girls. What are the criminal consequences of performing or assisting in female genital mutilation? It is against the U.S. law to perform female genital mutilation. I keep trying to say it fast. To perform this on a girl under the age of 18, or to send or attempt to send her outside the United States so that it can be performed. Violation of the law is punishable by 5 years in prison, fines, or both. There's no exception for performing female genital mutilation because of tradition or culture. Cutting and other procedures that injure the female genital organs of a girl under 18 are prohibited under U.S. law. What are the immigration consequences? Violation of the law, even without a criminal conviction, may have significant immigration consequences, including making one inadmissible to or removable from the United States, as well as ineligible for some immigration benefits. And then it basically talks about, have the women who have had it done broken any laws themselves, which it says, no, it's not her fault. She did not violate any U.S. laws by undergoing the procedure, and her eligibility to travel will not be affected. Okay, and this is from Child Protective Services, what they say about female genital mutilation, right? So what it is, they say it's a term for a range of procedures that involve partial or total removal of the external female genitalia for non-medical reasons. It's extremely painful and has serious medical consequences at the time it's carried out and later in life. So again, in order to, you know what, I'll wait. I'm not even going to get into that until we start to talk about the sex change part of it. I'll just keep going. So this is from the UK. FGM has been a specific offense since the Prohibition of Female Circumcision Act of 1985 came into force in September 1985. The act applied to the whole of the UK, and it was replaced by the Female Genital Mutilation Act of 2003, which came into force on March 2004. And it was further amended by the Serious Crime Act of 2015. So they think it's serious enough that they keep updating it. However, somehow it doesn't apply to allowing a child to pretty much do the same thing. It's a criminal offense to excise, I should know how to pronounce that, infibulate or otherwise mutilate the whole or any part of a girl or woman's labia minora, or clitoris. For a person to aid, abet, counsel, or procure a girl or woman to carry out FGM on her own genitalia, that's Section 2. To assist a non-UK person to mutilate a girl or woman's genitalia outside the UK, that's Section 3. To fail to protect a girl under 16 from risk of genital mutilation while they have the responsibility for her, this would apply to parents, Section 3A. For a UK national or resident to commit or allow any of the above offenses to be committed outside of the UK. And there's penalties, right? Penalties. A person guilty of an offense under sections 1, 2, and 3 of the 2003 Act can be sentenced to up to 14 years in prison for each offense. So this is in the UK. They're saying 14 years. And remember, in the one we just read that talked about the US, it said 5 years. A person guilty of an offense under Section 3A can be sentenced to up to 7 years in prison. So these are some pretty serious offenses, and this is real time we're talking. Protection for victims of female genital mutilation. A person against whom the offense of FGM is alleged to have been committed has a lifelong anonymity. English is not my strong suit today. Sorry, y'all. A breach of their anonymity is a summary offense which carries an unlimited fine. FGM protection orders. Sorry. Citizen Man said, God bless America where we protect the cat. I can't. FGM protection orders can be made by a court to protect women and girls who have either been or may become a victim of FGM. The orders can, for example, require the surrender of passports, prohibit travel or prohibit others from making arrangements. So of course, one of the most common things with, we'll say, FGM is that it typically happens in what would be considered underdeveloped countries. And so that's why they talk so much about traveling, because with it being outlawed in one place or another, a lot of times people are looking to, go to where they can have it done and not have to worry about doing, up to 14 years in prison. The role of CPS. The police investigate allegations of FGM if the police decide to refer a case to the CPS for a charging decision, we have to be satisfied there's enough evidence to secure a conviction. And it is the public interest to proceed. Not all reports of alleged FGM to the police will be referred by them to CPS for a charging decision. Evidence for a number of reasons. These include the young age and vulnerability. Oh my God. Oh Lord. Vulnerability of FGM victims who frequently do not report offenses that could lead to them giving evidence against their families. So I don't know if I read that clearly because I kept stuttering, but basically it's hard for them to prosecute because the girls are young and they don't want to tell on their family members, which makes complete sense, right? But if we now compare it to gender reassignment surgeries, right? They don't really have to tell because we already know. We don't know, but we kind of know. And it's pretty easy to figure out who, you know what? I take that back because how the hell are we going to know that? I don't know why I have that one in there twice, but let's move on. So now these are the countries that have laws against female genital mutilation. So the green places are where the specific criminal provision or national law prohibiting FGM. The light green is general criminal provision that might be used to prosecute FGM. Yellow is partial or subnational FGM criminalization or unclear legal status. Red, FGM is not criminalized, and there's a lot of red, so that's a little scary. And gray, there's no data, and there's a lot of gray too. But we can clearly see that in all of the US, it's criminal. You can't do that over here. Like Citizen Man said, we protect the cat. When it comes to this anyway, right? Now, if we look at Africa, there's a lot of areas where it is criminalized, and then there's a lot of areas where it's not really specific. And then over here, we see this huge red area, which means it's not criminalized, which is a bit scary. Did I skip one or did I go out of order? No, I think I did good. Okay. And this is the United States where, there are a couple states that don't criminalize it. Interesting. So most of the US does criminalize it, right? And then we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 states that do not criminalize it. Okay. And then just quickly, I want to go over the types of female genital. There are 4 major types. Right, Citizen Man, that's what I started with, circumcision. Now, I think the difference why it's not criminalized, circumcision for men, is because it doesn't affect a male's genitals as much as it affects a female. Because I'm about to tell you what types there are, but they cut off a lot more vital stuff when it comes to the girls because they don't want them to have, they don't want them to really enjoy sex or to have the urge to be sexual because they feel like that's a male trait. And in order for them to be pure and be feminine, they have to basically just be there to be an object for the man, but not have any sexual desire of their own. So it's a bit more, intrusive when they do the female genital basically the female circumcision. is a bit more intrusive than the male one. Now, mind you, I don't agree with circumcision for men either at all. That is absolutely another. But to quickly get into the types of genital mutilation, there's 4 types. Type 1 is a partial or total removal of the clitoral glands, external and visible part of the clitoris, which is the sensitive part of the female genitalia, and or the prepice / clitoral hood, the fold of skin surrounding the clitoral glands. Yeah, Citizen Man, absolutely. Type 1 would be like cutting off the head of a male's penis, which is crazy when you think about it. Like, what? Type 2, this is partial or total removal of the clitoral glands and the labia minora, the inner folds of the vulva, with or without removal of the labia majora, the outer folds and skin of the vulva. So, they're using all the technical terms. So if you don't know what that is, when you look at a vagina, it's got a bunch of levels and stuff. So we're talking about cutting off the lips in type 2, right? Type 3 is known as the infibulation. This is the narrowing of the vaginal opening through the creation of a covering seal. The seal is formed by cutting and repositioning the labia minora or labia majora, sometimes through stitching with or without removal of the clitoral prepuce and clitoral hood and glands. So basically now they're sewing the skin together. I can't. So this the man said that gives a whole new meaning to headless horseman. Yeah. Cutting off the head of the snake. And then type 4 includes other harmful procedures to the female genitalia for non-medical purposes: pricking, piercing, incising, scraping, cauterizing the genital. Can you imagine cauterizing? Like, are you serious? But I think what type 3 does, one thing that I was reading about FGM is they narrow the hole, like your actual vaginal opening. So they kind of like sew the lips of the skin together, and in an attempt to reduce the sensitivity of that area. Because again, if you're unfamiliar with how the female anatomy works, all of those folds and layers and stuff going on is sensitive. All of that have nerve endings in it. So it all adds to the sensation when you're being intimate with someone. And if we're cutting those off, as in type 2, or sewing them together, as in type 3, then you're going to reduce the sensation and make sex less pleasurable, which really is the goal of female genital mutilation. I thought that was my last slide, but it was not. So they go on to say that FGM has no health benefits. It harms girls and women in many ways. It involves removing and damaging healthy, and I think this is the key, right? It involves removing and damaging healthy and normal female genital tissue, and it interferes with the natural function of girls' and women's bodies, right? Again, is that not what gender reassignment surgery does? Is that not literally the purpose of genital reassignments, of gender reassignment surgery? Right? But somehow, some way, these two things have not been linked. Although all forms of FGM, oh, this is so small for you guys, I'm sorry. I can see it, so I forgot to check if you could see it. All forms of FGM are associated with increased risk of health complications. The risk is greater with more severe forms of FGM. How about some of the complications that can happen? Because again, we're looking at this from the lens of, of course, this is genital mutilation and it's horrible, but it's so similar to what we're doing for the gender reassignment surgery. So if we're doing a similar procedure, the complications would be similar, right? Severe pain, excessive bleeding or hemorrhage, genital tissue swelling, fever, infections, urinary problems, wound healing problems, injury to surrounding genital tissue, shock, death. Long-term complications can include urinary tract problems, painful urination, vaginal problems, discharge, itching, bacterial vaginosis, which is basically like a yeast infection, and other infections. Many blowing up the hole to make it smaller, yeah, everything that naturally is supposed to come out is not going to be able to pass. And that's also why they would have issues with, and I'm surprised they didn't say, with childbirth. Wait, is there more? Maybe there's more. Oh, yes, there's more. Scar and keloids, sexual problems. Here we are. Increased risk of childbirth complications, difficulty delivering, excessive bleeding, cesarean section, need to resuscitate the baby. And then the need for later surgeries. For example, the sealing or narrowing of the vaginal opening may lead to the practice of cutting open the sealed vagina later to allow for sexual intercourse and childbirth. Sometimes genital tissue is stretched again several times, including after childbirth. Hence, the woman goes through repeated opening and closing procedures, further increasing both immediate and long-term risks. Can you imagine not only, having your vagina sewed up once, but literally having to have it open every time, like cut open every time you have a baby, and then close back up every time, you're finished having the baby. And for no real reason, really just to make you not want to have sex. And I don't think I added that part in. Okay, so cultural and social factors. So this kind of gets into the reasoning, and this is really the only major difference, in my opinion, between FGM and sexual reassignment surgery, is that when it comes to genital mutilation, there are cultural reasons, and this is something that cultures have been doing for years, like a long time. And the reason that it's performed, they vary, of course, from one reason to another, as well as over time, and include a mix of social cultural factors within families and communities. Oh, excuse me. Goodness. Where FGM is a social convention, the social pressure to conform to what others do and have been doing, as well as the need to be accepted socially and the fear of being rejected by the community, are strong motivations to perpetuate the practice. Include controlling her sexuality to promote premarital virginity and marital fidelity. Goodness gracious. I mean, okay, side note. It's kind of crazy when you think, right? Other cultures would go through this extent in order to keep their women pure, right? Literally cut her body up to keep her pure. Like, it tells you how important that a woman's virtue really is. And then you look at America, and we have, especially now, we have the whole culture, we have feminism, we have women just doing whatever the hell they want. And it's like there are literally women getting cut, and sometimes irrevocably injured in order to keep them, sexually vital. And it's just, yeah, it just baffles my mind. Hi, Helen. Welcome in. Okay, so some people believe that the practice has religious support, although no religious scripts prescribe the practice. Religious leaders take varying positions with regard to FGM, with some contributing to its abandonment. Reasons for medicalized FGM. So what they haven't said so far, and the reason for the thumbnail, if you guys saw it, it was a woman with a razor in her hand. One of the reasons that FGM has been, the attempt has been to outlaw it, is that for years, people were doing it like in their homes with a razor. And they would have a line of girls who are all coming of age at the same time, and they all would just get cut with the same razor back to back to back to back. So now, or at least when this article was published, they're talking about why they medicalized it. And one of the reasons is that obviously doing it in that way is not sterile. It's not, I mean, it's not a sterile or healthy thing to do anyway, but obviously everybody knows you need clean equipment if you're going to be cutting skin. You can't use it with someone else's blood on it. Like, it's just wrong. And so these are some of the reasons why they would want to do it like in a facility with a doctor. So some of the reasons that they say is that the belief is there's a reduced risk of complications, and the belief of medicalization of FGM could be a step towards full abandonment of the practice. So if we're doing it, if the doctors are doing it, then maybe it'll shed light on it enough that we're like, you know, why are we doing this again? Okay, so now we segue into the gender reassignment surgery, right? And we're going to attempt to draw the line between the two and see how similar they are. So I focused on female to male just because obviously the whole literally female genital mutilation is about women and what parts of their body is being cut off and what the legalities are behind that and all that stuff. So I just felt like it would be easier to draw comparison when looking at gender reassignment surgery from going from a female to a male. And I saw some pictures, y'all. I really wish I could share them with you, but it would be considered nudity. But I was baffled by the stuff that I was seeing. You know what? What I'm going to do is post the links for, it was a couple articles and stuff that I read. I will post them on my community tab and on my IG. So if you follow me on if you're here, I hope you follow me on here. But if not, but man, you wouldn't believe the stuff I saw when I was researching for the show. So what to know about female to male surgery? Female to male surgery is a type of sex reassignment surgery, also called gender affirmation, gender affirmation or gender affirming surgery. This can take different forms, including removal of breasts, healthy tissue, right, which we talked about, a mastectomy, and the altering of the genital region known as bottom surgery. Examples of bottom surgery include removal of the uterus, known as a hysterectomy, removal of the vagina, known as a vaginectomy, construction of a penis through, bear with me, metoidioplasty. We're going to go with that. Metoidioplasty or phalloplasty. In this article, we describe female to male gender affirming surgeries. We also discuss recovery and what to expect from a transgender penis. So this article, if you don't hear it yet, is kind of geared towards somebody who's considering having the surgery and what to expect and all that stuff. So before having female to male gender affirming surgery, a person will receive testosterone replacement therapy, which isn't always true. They like to say that to make it seem like there are logical steps before we get to surgery. However, it's not always that way. If nowadays how it works is that if somebody wants to just skip ahead to the surgery, 9 times out of 10, they're allowed to do so. And if they're underage, all they need is their parents' consent. And the problem that I've covered in previous shows is that, parents are basically strong-armed into consenting by being told, well, if you don't consent, your child is going to be suicidal, they're going to kill themselves. And the craziest part is that they say this like they know this to be true, but then on the other hand, they admit that there's no long-term studies of transgender people. So how on earth could you know that if a person doesn't get surgery, they're going to be suicidal if there are no long-term studies of transgender people? They don't. They don't. It's fear-mongering, and they're telling the parents this to get them to do these procedures without really doing their due diligence, because there are other things that can be done before we take that leap into cutting off healthy body parts. Okay, so a couple of the procedures that they might undergo are chest restructuring, which obviously if a woman wants to be a man, she's going to cut off her breast, which they mentioned. The surgeon will also make alterations to the appearance and position of the nipples. And boy, like I said, there was some stuff. I'm going to post the article, but there was some stuff. Like one of the articles I saw, it showed how like, okay, so not to be too graphic, but you know how like some women have nipples that are like they poke out. So if that's the case and this woman now wants to be a man, what they do is horizontally they cut the nipple in half and then they flip it up so that it looks like more flat and it doesn't protrude as much. And obviously this is after they remove all the breast tissue, and that's how they make the chest for this woman look like a man. But again, you'll see like little illustrations in the article that I post. I was scared to put it on the show because I'm like, ooh, right next to it is a whole breast, and I don't know, it might be a problem. So another procedure is removal of the uterus, ovaries, and fallopian tubes. A person may wish to undergo this type of surgery if they're uncomfortable having a uterus, ovaries, or fallopian tubes, or if hormone therapy does not stop menstruation. In a partial hysterectomy, English man, hysterectomy, a surgeon will remove only the uterus. A bilateral salpingo, or that was the word. I was supposed to practice this one. Oophorectomy. Yep, that's it. Or BSO, yeah, I like BSO so much better, involves the removal of the right and left fallopian tubes and ovaries. Now, the metoidioplasty is the first method of constructing a quote-unquote neopenis. It involves changing the clitoris into a penis. A person will receive hormone therapy before the surgery to enlarge the clitoris for this purpose. During the procedure, the surgeon also removes the vagina in a vaginectomy, which sounds crazy. How do you remove an opening? Neopenis. To achieve the lengthening, the surgeon uses tissues from the cheek, labia minora, and other parts of the vagina. The aim of this to allow the person to urinate while standing. Now, this again isn't always true. I think I have another article that talks about this exact method, and they say that it's just there. It literally does nothing. So let me just finish reading it really quick. In addition, they lengthen the urethra and position it through the neopenis. To achieve the lengthening, I said that. Another option is the centuron procedure, which involves repositioning round ligaments under the clitoris to increase the girth of the penis. This procedure typically takes 2 to 5 hours. After the initial surgery, additional procedures may be necessary. So what I was going to say is that basically what they do in this specific method is they give the woman a micropenis, right? It has no functionality. Apparently this office attempts to give a woman as much functionality as possible. But what I was reading overall about this procedure is that they have this neopenis that does not get erect for sex. You cannot pee through it. And I lost my whole train of thought, sorry. But basically it's too small to do anything. Like even if it was erect, there's not enough there to insert inside someone else. So it doesn't really have a purpose other than it looks like a penis. That's all you get. And they give them a fake scrotum also. An advantage, so I guess with how they do it, right? An advantage of this procedure is that the neopenis may become erect due to the erectile abilities of the clitoral tissue. However, the neopenis resulting from medioplasty is often too small for penetrative sex. right? Which is exactly what I just told you guys. Like it's a micro penis, so you can't do anything with it, but look at it. Ooh, what's that? A phalloplasty uses grafted skin, usually from the arm, thigh, back, or abdomen, to form a neopenis. Doctors consider taking skin from the forearm to be the best option, and I'm going to show you guys what exactly the forearm looks like after they take everything they need. Compared to a I need to give this a nickname or something. Why? Medioplasty, a phalloplasty results in a larger penis. However, the neopenis cannot become erect on its own. After a period of recovery, a person can have a penile implant. This will allow them to get and maintain erections and have penetrative sex. During a phalloplasty, the surgeon performs a vaginectomy and lengthens the urethra to allow for urine to pass through the penis. So again, there's literally no way for them to perform this procedure without falling under the umbrella of what was considered female genital mutilation, right? Because you have to remove everything that is feminine, right? Which includes the clitoris. Well, you don't remove the clitoris, you lengthen it, right? But you are still altering it in some way. And then you have to remove the lips. And then they quote unquote remove the vagina, which I think sounds so weird because it goes inside of you. So how do you remove that? They close it. They take everything out and then they close it up. Disadvantages of the phalloplasty include the number of surgical visits and revisions that might be necessary, as well as the cost. Oh yeah, this isn't cheap, which is typically higher than that of a medioplasty. Now the scrotoplasty, that's how they give them a fake scrotum. And this they don't have to do, but if they're really committed to this life, they probably should. A person may decide to have a scrotoplasty alongside with either one of the other two to create the neopenis. In a scrotoplasty, a surgeon hollows out and repositions the labia majora. Remember, this is what they're not allowed to touch according to female genital mutilation rules and laws and stipulations, to form a scrotum and insert silicone testicular implants. So I wonder if they use those balls that hang off the back of people's trucks. Like, do they look like that? Like we just, make them silicone instead of plastic and just throw them under some skin and there you go? I just don't understand. I don't understand what the purpose of all this is. The recovery time from female to male surgery. Right, exactly, Citizen Man. They sew on a sack of marbles. And hopefully they're not metal, so they're not clanking together as they walk. A recovery time from female to male surgery varies depending on the type of procedure and factors such as a person's overall health and lifestyle choices. For example, smoking slows down recovery. If a person smokes, okay, we don't really need to know that. Following gender-affirming surgery, most people need to stay in the hospital for at least a couple of days. After leaving the hospital, a person needs to rest and only engage in limited activities for about 6 weeks or longer. Also, when a person has a urethral extension, they need to use a catheter for 3 to 4 weeks. This is dedication. Like I'm really trying to understand. Some complications of a medioplasty or phalloplasty include urethral fistula, a tunneled connection that forms between the urethra and another part of the body, or urethral stricture, a narrowing that causes blockage of urine flow within the urethra. A person who has experienced a phalloplasty may experience A person who has had a phalloplasty may experience scarring in the area where the draft was taken, skin draft failure, or tissue death. Risks of scrotoplasty include rejection of the testicular implants. Body don't like the marbles, I'm guessing. All gender-affirming surgeries can carry a risk of infection, bleeding, reactions to anesthesia, or dissatisfaction with results. I mean, dissatisfaction is that's probably the scariest one, because you go through all of this and completely alter your body and then you don't like it. Ugh. What to expect? A person who undergoes a medioplasty may have erections and enjoy more sensation in their neopenis. However, the penis will be relatively small in size. All of that just to be a man with a micropenis. A neopenis that results from a phalloplasty is usually larger, though it may be less sensitive. Oh wait, I misspoke. All of that just to be a trans man with a micropenis. A neopenis that results from a phalloplasty is usually larger, though it may be less sensitive to have erections. A person will need a penile implant. And that's the other thing. When you get the phalloplasty, you have a larger member, and you may have the ability to get an erection, but in order to do that, you have to get the implant, the penile implant. If a person has urethral extension, the goal is to be able to urinate while standing after a full recovery from the procedure. So all of this just to urinate while standing? Like, it ain't, come on, it ain't all of that. Some studies report a high number of urological, and then sometimes it don't even work, urological complications following phalloplasties. It's important to attend regular follow-ups with a urologist. And that's one of the main goals, if you ask me. It's a lifetime patient. You know, we talk people into getting these procedures, and they cannot miss their visits, because who knows, the freaking neopenis might die and fall off. Better make sure you're at all of them visits on time with bells on. A 2005 study of 55 people who underwent gender-affirming surgery included 23 female to male participants, notes that 83% of all participants reported improvement of their sexuality following surgery. I find that very hard to believe. Especially because most of them can't use it for sex. Transgender men tend to report more frequent masturbation, sexual satisfaction, excitement than transgender women. Of course, because assuming you have feeling in your neopenis, you know, we're talking about going from having a vagina to having a penis, and then going from having a penis to having a vagina. Like, I'm pretty sure that goes without saying. Of course, the people who now have a penis are going to enjoy sex more. Again, assuming they can feel anything. They also reported reaching orgasms more easily than they had before surgery. See, all of this to me, honestly, sounds like they're trying to sell it. Because as I read on, I hope I put it in here. As I read on it, those numbers are inflated a bit, quite honestly. Transgender men with penile implants, and here we go. Transgender men with penile implants for erections experienced pain more frequently during sex than those without implants. However, they also reported that their sexual expectations were more fully realized compared with participants who had not received implants. A 2018 study found that 94 to 100% of participants who had undergone gender-affirming surgery reported satisfaction with their surgical results, with a variance depending on the type of procedure. Again, that sounds completely inflated, because what study do you ever get 94 to 100% of people agreeing on anything? There's always those that are just, going to be a contrarian just for the sake of giving you a hard time. Like, I don't believe this at all. The 6% of people who reported dissatisfaction or regret did so as a result of preoperative psychological symptoms or complications following the procedure. Right. Because, as we all know, gender dysphoria is a mental disorder, not a physical disorder. So you can't fix it with a physical change. Citizen man. Like, being a man isn't hard enough. Now they want to be little dick men. They're doomed. Right. Why would you sign up for that? Like, you had a vagina. Do you know the power that you have just owning one of those, and you traded it in for a micro penis? Really? The outlook of female to male surgery depends on the type of surgery, the person's health, and other factors. People report satisfaction. I don't really know why I put this in there, because I feel like it's just like a summary of what we just read. Next. Oh, right. Here we go. Here is an arm after it's been grafted for a penis. Look at that. There's like nothing left. That all of that is never coming back. I just can't even imagine. All that's going to happen is she's going to now have skin, but she'll forever have this like indent in her arm. Okay, so just to give you a little bit more details about life after they get the neopenis. Yeah, Helen, pretty much down to the bones. They take all the muscles, all the tissue, everything there, and they create. I really wish I could have shown you the other picture because it shows you the phallus. And I mean, obviously, it's never going to look like the real thing, but it does have like some girth. It does have some length to it and all that. But it's crazy to think that you're making yourself a lifetime patient, not only for the grafts that you had from your arm, but now from what you did to your genitals. And 2, it might not even work. And in order for it to work as it should as a man, you have to go back and get more surgeries, which could cause more complications. All of this because they're not taught to be happy with themselves. Like if I don't like my ears, right? I'm not going to go to a doctor and have my ears cut off and get new ears sewn on. Like that's not how it works. I got to learn to love my ears. Get some piercings or something. So to get into more detail about their lives after they now have this new neopenis. So this was an article that I had to chop up because it was really long. And once I start reading it, you'll see how wordy it is. Like some of the words are like, maybe I should define that real quick. So I cut it up and just took out what was important. But I can also post this if you guys are interested to read the whole thing, have at it. So talking about voiding while standing, or of course peeing while standing up, for biological males, as well as female to male transsexuals undergoing a phalloplasty, the ability to void while standing is a high priority. I'm not sure why, but okay. Excuse me. Unfortunately, the reported incidences of urological complications such as urethrocuttinitis fistulas, stenosis, strictures, and hairy urethras are extremely high in all series of phalloplasties, as high as 80%. Now, do you guys remember what the numbers were? What they said satisfaction was, right? I'm pretty sure they said in one study, they said it was 80%, and the other one, they said it was 94 to 100%. So how is that possible if as high as 80% of people have these complications? So they just proved my point, right? There's no way. They're inflating the numbers to sell these procedures. Hairy urethras. That's because a woman's urethra is attached to her mound, right? Which is where the hair grows. Now, if you're extending that in order to make it go through a fake penis, then of course there's going to be some hair. And I would think that a medical professional would know that and would understand that maybe there really isn't a point to doing this. I mean, you know what? What am I talking about? They know that. They know all of this, but they don't care. For this reason, certain well-intentioned surgeons have stopped reconstructing a complete neourethra. So some of them came to their senses and said, you know what? This really doesn't make sense. You know, the female anatomy is not really meant to be changed into the male anatomy, so we probably should stop. Yeah, Helen, it is about the money. Absolutely. These procedures are expensive, and some health insurances cover them, but some don't, and they have to do all of this out of pocket. You know, and they are making bank to mutilate these people. In their series of radial forearm phalloplasties, Hobeek and Monstre still reported a urological complication rate of 41%, 119 out of 287, but the majority of these early fistulas close spontaneously, and ultimately all patients were able to void through the newly reconstructed penis. Oh, so that's actually a good thing. Because it is unknown how the new urethra, a 16 centimeter skin tube, will affect bladder function in the long term, lifelong urologic follow-up is strongly recommended for all patients. And what do I hear? Cha-ching, 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 money, money. Not only did they pay for the procedure, but they're going to pay for those co-pays every time they have to come back. They're going to pay for, if they have complications and have to go back in, they have to pay for that. So yeah, it's just like Helen said, all about the almighty dollar. Make sure y'all hit that like button as you're coming in. Don't forget, wipe your feet at the door. And then let's see, minimal morbidity. Complications following phalloplasty include the general complications attendant to any surgical intervention, such as minor wound healing problems in the groin area, or a few patients with minor pulmonary embolism. Wow. Despite adequate prevention, interrupting hormonal therapy, fractioned hairpin. Okay. A vaginectomy is usually considered a particularly difficult operation with high risks of post-operative bleeding. But in their series, no major bleedings were seen. 2 patients displayed symptoms of nerve compression in the lower leg, but after reducing the length of the genealogical positioning to under, I don't know if I even still have the rest of it. Yeah, I didn't care to keep the rest of it. Sorry, y'all. Sorry to leave you on a cliffhanger, but go to my IG. The link will be there. Okay, so this is getting into the removal of the normal female organs in order to make them into a male. So obviously we all know what a hysterectomy is, right? Was this the right one? Hold on, because I had a mix up at one point. I just want to make sure I got the right one. Okay, yes, good. Okay, a hysterectomy is a surgical procedure to remove a uterus. A total hysterectomy involves the uterus and the cervix, and a subpartial hysterectomy involves removal of only the uterus. And the cervix, though? Goodness gracious. Bilateral BSO, that's what we agreed to call it, is the removal of both ovaries and fallopian tubes. According to the ACOG, symptomatic urine leiomyas are the most common indication for hysterectomy in the US, followed by abnormal urine bleeding, endometriosis, and prolapse. Right, like Citizen Man said, hit that like button. Risk-reducing hysterectomy is also performed for patients with high-risk endometrial cancer, including, so they're talking about why we normally do hysterectomy, right? It's normally like a last resort if somebody's really sick. And they can be performed through 3 methods: abdominal, laparoscopic, or vaginal. Abdominal hysterectomy is performed with incision to the abdominal wall, whereas laparoscopic and vaginal hysterectomy are minimally invasive procedures. How can you even call it minimally invasive when you are removing all of the freaking important reproductive organs for a female? Current ACOG guidelines recommend minimally invasive procedures, specifically vaginal hysterectomy over surgical hysterectomy due to faster recovery time. I guess they mean minimally invasive because they don't have to cut you as much. Shorter procedural time. Losing my line here. Shorter hospital stays and better quality of life. Discharge from minimally invasive hysterectomy can occur as fast as 1 day post-operative, in contrast to 5 days post-operation for abdominal hysterectomies. Following discharge, patients also often experience gastrointestinal symptoms such as constipation or urinary tract infection, as well as vaginal bleeding or discharge. These symptoms should be temporary and resolve within 6 weeks. And a follow-up visit is recommended. Follow-up care for male identifying patients with uterus, women, should still see a gynecologist for a checkup at least every 3 years. This is particularly the case for patients who retain their vagina, whether before or after genital reconstruction. Oh yeah, I don't think I mentioned that. It might be on my next slide, where they can keep their vagina and get the neopenis, right? So they basically make themselves a hermaphrodite. Like, what? So my question is, does that mean they can fuck themselves? Sorry, I shouldn't. That wasn't. All right, I take it back. Have a strong family history of cancers of the breast, ovary, or uterus. Have a personal history of gynecological cancer or significant dysplasia. I'm gonna go with that. On a pap smear. Develop vaginal bleeding post-operation and hormone therapy. Okay. Now, these again are the type of surgeries that we can get in order to create a fake penis. So, as we stated before, we have the phalloplasty. You're right, Citizen Man. They do fuck themselves, just not in a good way. Yep, they definitely do. Is the process of constructing a neopenis using a flap or graft from the patient's arm, thigh, abdomen, or back. It provides a larger penis with more satisfying cosmetic appearance. However, it's more expensive, and many times the penis lacks the ability to achieve an erection. Therefore, they have to now get a second surgery in order to get an erection. Sexual sensation is usually preserved at the base of the penis, where the original clitoris was. For the medioplasty, it's done after enlarging the clitoris using hormone replacement therapy. It's constructed from an enlarged clitoris with or without extending the urethra. So that kind of goes into what I was saying before. Like the article that I read the first time said that they did extend the urethra and put it through the neophallus. Not always is that the case. So with or without extending the urethra to allow for urination while standing up. The labia minora are united to form a scrotum where the prosthetic testicles can be inserted. The neophallus ranges from 4 to 10 centimeters with an average of 5.7 centimeters. Centimeters, not even inches, that is tiny. And has the approximate girth of a human adult thumb. Let me read that again, hold on. The new neophallus ranges in size from 4 to 10 centimeters with an average of 5.7 centimeters and has the approximate girth of a human adult thumb. Good Lord, that's little. Sexual sensation and erectile function are usually completely preserved. Specialized medioplasty penile implants may be an option in those who cannot achieve penetration during sex. Well, I mean, if it's 4 centimeters, I don't know what you're doing. You might as well just rub that up against something. Penile implants are usually used in phalloplasty surgery due to the inability of the neophallus to achieve proper erection. The penile implants are used in cisgender men to treat erectile dysfunction and in transgender men during female to male sex reassignment surgery. Although the same penile implant has been used for both cisgender and transgender men, specialized penile implants for transgender men were recently developed by Dr. Ziffor, I thought that was his whole name, by Dr. Ziffor, surgical implants in both inflatable and malleable models. Inflatable though? Like how does that work? You just press a button? During phalloplasty, the tissue flap used to build the neophallus is wrapped around the implant either in the same surgery or separate surgeries. Penile implants are less commonly used in medioplasty due to how the process is done. But can you imagine though, you just press a button and that joint stands up? Like, you don't ever have to worry about Cialis? Okay, so this is all the gender clinics in the United States. So I thought that was important because I did show you guys where female genital mutilation has been outlawed, right? And now these are all the places where we are completely and utterly allowed and even encouraged to mutilate our genders. I'm going to go back to that one. Transgender health. What is this one? Sorry, I just completely lost. Oh, this is talking about the age limits. Okay, so the reason for that is when it comes to female genital mutilation, it's something that's usually done, which I think I read in one of my articles. It's done on young girls from infancy to about, 14 years of age. So I kind of wanted to draw the comparison between that and the gender affirming surgery and treatments, because as we all know, this is something that's being done younger and younger, right? So let's take a look at that. In the organization's latest recommendations regarding the treatment of transgender youth and adults, the World Professional Association for Transgender Health, or WPATH, decided to remove age restrictions for gender-affirming treatment and surgery. Which before they removed it, it depended on what a child wanted. But for hormone therapy, they could start as early as 8 or 9. For like a mastectomy, having both breasts removed, about, I believe, 14. And for the actual gender reassignment surgery, it was 15 to 17 was the youngest that they could do that. Obviously, in all these cases, they need parental consent. And obviously, we already talked about how they get parental consent, which isn't always that the parent actually agrees, which would make sense because most parents wouldn't agree with, cutting their child for no reason. WPATH, which consists of doctors from across the world who treat transgender patients, previously leaked a draft version of the Hold on one second, guys. My computer is dying. Hold on. Okay, sorry about that. I thought I was going to be good, but this thing kills my battery when I go live on this computer. Okay. WPATH, which consists of doctors from across the world who treat... Hold on, let me just do a quick sound check. Make sure you guys can still hear me. Mic check. Okay. There we go. WPATH, which consists of doctors from across the world who treat transgender patients, previously leaked a draft version of the organization's latest recommendations, which had not been updated in a decade. In a leaked draft version, WPATH lowered the age at which it recommended hormone therapy could be safely started from 16 years old to 14 years old. The draft version of WPATH guidelines also recommended that some sexual reassignment surgeries could begin at age 15 or 17, which was a year earlier than WPATH's previous guidance recommended. But in WPATH's latest guidelines, sections of Standards of Care 8, the organization swapped the age limit threshold for one that relies on an individual stage of puberty. And that's what allows kids as young as 8 or 9 to go ahead with this gender affirming care, because they're saying, I should say, that the age limit threshold relies on the stage of puberty, but puberty can start as young as 8 or 9. Yesterday, WPATH published their newest standard of care for transgender and gender diverse people. They issued a correction on the same day. What was corrected? Without justification, it was corrected to remove all age restrictions for receiving gender affirming care. And this happened back in September. Specifically, WPATH guidelines asserted that the decision of whether an adolescent can safely begin cross-sex hormone treatment or puberty blockers depends on where the patient falls within the Tanner stages of puberty, which were created by child development expert Professor James Tanner. Once an adolescent has reached Tanner stage Tanner stage 2 of puberty, pubertal suppression can be initiated, according to WPATH Standard of Care 8. According to pediatric endocrinologist Stephanie Roberts, Tanner stage 2 refers to the first stages of puberty, which can begin as early as 8 years old in girls and 9 years old in boys. Safeguarding of children is no more. Age limits for puberty blockers, hormones, or surgery are removed. As long as a child has reached Tanner stage 2, which can be as young as 9, there's no requirement for a child to have taken hormones prior to surgery if not desired. And so that was what I was talking about earlier, where the one article said that they have to do, hormones first. It's not always the case. It's not. And they're becoming more and more they're relaxing those guidelines more and more to allow for more and more kids to participate in these surgeries. Similar to the guidelines pertaining to cross-sex hormones and puberty blockers, WPATH did not provide a hard and fast age recommendation for gender reassignment surgeries either. But the guidelines did indicate certain gender-affirming surgeries, such as vaginoplasty or double mastectomy, could be considered in minors. And obviously I don't agree with it. If you're here, you know my stance on all of this. But I just can't even imagine a young girl, she just got her breast. She just came into her, womanhood, and she's going to cut them off. And the doctor, her parents, the quote unquote psychologist that she's talking to in order to get approval for this stuff, everybody is okay with it. Everybody's going to sign off on this. However, phalloplasty procedures, which is a surgical creation, so that's where they draw the line, right? Which is the surgical creation of a penis, was not included among the surgeries WPATH said could be considered for minors. So they can't get the phalloplasty, but they can get the vaginoplasty, which is basically, I didn't mean to do that. Sorry guys. They can't get the phalloplasty, but they can get the vaginoplasty, which is basically sewing up of their vagina. And they can get both of their breasts removed. So they can turn themselves into a Barbie doll, essentially, right? But they can't take the next step and get the phalloplasty. We're letting them already do so much damage. Why not just let the dogs out? Oh, God. It's hard to read this. There may be a benefit for some adolescents to having these procedures performed before the age of 18. Benefits? What the hell is the benefit to having your body mutilated before you turn 18? That's what their guidelines stated, but the group concedes that given the complexity and irreversibility of these procedures, it's imperative to adhere to post-surgical care recommendations and to comprehend the long-term impacts of these procedures on reproductive and sexual function. And many adolescents may not be capable of doing this. Of course they're not capable of doing it. My son is 10 years old. He is not capable of remembering to have me sign his agenda every day when he comes home from school. And he knows that if he doesn't, that he's going to hear it from his teacher when he goes back to school. He knows this, right? Obviously, his young mind is so focused on everything else going on in his life and his world that he's not thinking about the implications of what's going to happen if he forgets to do this thing and goes back to school without it. And that's on a very small scale. So can we talk about actually making a huge change to your body? And you're talking about a 9, 10, 14, 15-year-old understanding that cutting this off means that they can never breastfeed their kids, or sewing up their vagina and taking out all the vital organs means that they'll never be able to bear a child. And it's not like you can now father a child because you call yourself a quote unquote man. No, now you are literally a eunuch that has no sexual organs. Of course, a child can't comprehend what that means and, you know, what their life will now look like. That's why they have parents who are supposed to make those decisions for them. That's why they have doctors who are supposed to, quote unquote, do no harm. I mean, that is the oath that they're supposed to take, right? That they're not going to purposely do anything to a patient that's going to harm them on the long term. You cannot sit here and tell me that these doctors are not aware that these procedures are harmful. Speaking of doctors, doctors are told to provide education to children on chest binding and genital tucking to provide comfort and lower rates of misgendering. What? This is even though the former can cause pain, infection, and fracture, and the latter can cause decreased sperm concentration. Oh God, I just can't even. WPATH is now run by people in the gender ideology industry, meaning they all have an enormous financial, there it is, Helen, you see that? They all have an enormous financial stake in making transition guidelines as relaxed as possible. Conservative political commentator and filmmaker Matt Walsh tweeted, and what do you know? Each set of new guidelines becomes more relaxed, and they all get personally richer. Ugh, disgusting. This is disgusting. And if you're wondering if there's anywhere that you can go that, you know, they have their wits about them and they are making the right decisions as far as this quote unquote gender affirming care, these are the states that have bans on these types of procedure. So all the ones in like the red burgundy-ish color, there are bans. Georgia has a partial ban. So the ones that I see are Arizona, Utah, South Dakota, Iowa, Arkansas, Mississippi, Alabama, Florida, Tennessee, and Kentucky. And then all the ones in this like lightish, reddish, pinkish color, they're considering bans. All the green has no bans, of course. California, New York. Yeah, we know. We know how y'all roll. Yep. Take a gander, y'all. If you have kids and you're afraid that, you know, you don't want them around these types of individuals, you don't want them seeing these things and being exposed to it, we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and Georgia's on the fence. Places that are, at least in this stance, it's banned completely. They might have other stuff going on, but you don't got to worry about them having a kid in their class who at the beginning of the year was a boy and at the end of the year is a girl. And this is just more about the age of consent and which procedures are allowed. Age of consent, the question of cosmetic surgery in teens can be a thorny subject. There's no specific laws in the United States that prevent teenagers from getting cosmetic surgery. However, partial consent is required for parents under the age of 18. Therefore, the responsibility falls on the parents to help their children make the right decision. Yeah, which we already covered that. But this is where I'm going to end it off, guys. That there are some places, and, you know, there is a lot of pink. So there are places that are coming around and starting to realize that this is not benefiting us or our kids. And this directed effort towards targeting our kids and trying to basically make them eunuchs who can't have kids is crazy. And, you know, something absolutely has to be done about it. So to tie it all in a nice little bow, is is gender affirming care and reassignment surgery, sex reassignment surgery, a form of genital mutilation? In my opinion, abso-fucking-lutely. There's no question about it. I mean, you literally have to cut up a child or a person, because it's not always a child, but my focus, of course, is the kids. And you have to cut it up in order to make them something that they're not. And again, I've said this on previous streams, but what people fail to realize is that gender is genetic. It depends on what chromosomes you're given, as a zygote. So, I'm sorry, excuse me. You cannot change that no matter what you do to the outside. If I take an orange out of the fridge and paint the outside to look like an apple, you cut that orange open and it's still an apple. I mean, you cut that trans apple open and it's still an orange. It's not going to change. And this is what people, for some reason, tend to believe that these sexual reassignment surgeries are going to do for them. So much so that they want to be called women or men, not trans women, not trans men. They want to have all the rights and acceptance that comes with being a natural born woman or man, which is utterly ridiculous. They don't want people to not want to date them because, they present themselves as something that they're not, which again is absolutely ridiculous. So I hope that I've proven my point that sex reassignment surgery absolutely is a form of genital mutilation. And just as there are laws protecting children from being a victim of genital mutilation, that should also be the case for these sexual reassignment surgeries. The parents should be prosecuted. The parents should be prosecuted and thrown under the jail for what they're doing to their kids. Especially when you look at the amount of children who grow up and realize that they made a bad decision, and they were allowed to make a bad decision when they weren't even old enough to buy cough syrup at the store. The doctors who are perpetuating these surgeries should also be in prison. Just as if it was a genital mutilation, they would be. I mean, I shouldn't even say it like that because it is a genital mutilation. But if it was what they deem or what they classify under the umbrella, because obviously they're very selective about what is and what isn't. So if it fell under that umbrella in their eyes, that doctor would be in prison. Therefore, when they cut up a child in order to make their vagina into a penis or vice versa, yeah, they should absolutely be in jail. So as promised, I will put those links. I'm just going to put it on my IG because I want to get some traffic over there. So if you guys want to see those links that I was talking about earlier in the stream, I'll have them on my IG, which is RnBBae. And thank you guys so much for coming out. I really appreciate the support. And I will definitely be live again next Saturday. If I'm able to do a stream in between now and then I will. If not, you can expect to see me next Saturday at 10. If you haven't already hit the like, please, and thank you. If you aren't already subscribed, go ahead and do that. Don't forget to hit the bell and share the stream, share the video, because this information is really important to get out. And there definitely now are a lot of people coming out, thank goodness, and talking about this topic. People's eyes are really opening, but the more we can, get people to understand what exactly is going on and everything, the better and the further our message will spread, of course. So again, thank you guys so much for being here. I really, really, truly appreciate the support. And I'll see you guys next week for sure. All right. Have a good one and enjoy the rest of your weekend.